Advantages and disadvantages of peritoneal dialysis. Hello, my name is Ellen. I am a retired renal nurse. When you reach stage 5 end-stage renal failure, there's no further to go as your kidneys have failed and you need treatment to stay alive. This treatment is called renal replacement therapy. There are two main types, hemodialysis and peritoneal dialysis. There is also having a transplant and palliative care, which is no treatment at all. This video will deal with the advantages and disadvantages of peritoneal dialysis. We also have another video on the advantages and disadvantages of hemodialysis. How does peritoneal dialysis work? There is a membrane around your internal organs called the peritoneum lining the peritoneal cavity. Peritoneal dialysis works by using that lining and all the capillaries and blood vessels attached as a filter. The dialysis works by putting fluid into this cavity. This fluid has electrolytes in it in the normal concentration of your blood and glucose. The fluid dwells there for several hours and through osmosis diffusion cleans the blood and takes out the excess fluid. Osmosis is the movement of solvent particles across a semi-permeable membrane from a dilute solution into a concentrated solution. The solvent moves to dilute the concentrated solution and equalize the concentration on both sides of the membrane. Diffusion is the movement of particles from an area of higher concentration to lower concentration. The overall effect is to equalize concentration throughout the medium. Each time you do this is called an exchange. This can be done manually and needs to be done at least 4 times a day. This is called continuous ambulatory peritoneal dialysis (CAPD), or by a machine that you attach to that pumps the fluid in and out, usually overnight. Continuous cycling peritoneal dialysis (CCPD). Peritoneal dialysis has the advantage of provides a continuous gentle dialysis. There are no highs and lows as with hemodialysis. It is possible to have a better diet on peritoneal dialysis. More protein is encouraged. You can do it at home and anywhere there is facilities to wash your hands and has clean work surfaces. Some of the patients I trained do their exchanges at work. It is relatively easy to learn. Once the manual exchange is done, which takes about half an hour, you can disconnect and are free to do as you wish. Alternatively, using the machine requires you to be attached at night, but you are free all day. You can travel with it either by doing manual exchanges or taking your machine with you. It just takes organization with your supplier. The disadvantage is that this must be done every day 4 times a day or every night, which is a commitment. It works best if you still have some residual function, and some people start out on peritoneal dialysis, then need to go on to hemodialysis when their natural function decreases. You need to be scrupulously clean when doing the exchanges, as one of the biggest problems can be something called peritonitis, an infection of the peritoneal lining. It can be painful, and you will need to have antibiotic treatment. To see more videos and learn more, go to our channel Ellen and Michael Moriarty, 2 RNs. We hope this helps you. Ellen and Michael Moriarty, 2 RNs.